So we're going to be doing AP of the tibio-femoral joint. As you see, we've set it up so that we've got some supports underneath the femur. We just need to make sure there's nothing getting in the way of the tibia. Also in this position, what I've actually done is I've just popped a towel underneath the heel, well just above the heel really, Achilles sort of tendon region, just so that I've got enough gap behind here so that when I apply my AP, that I don't get too much compression of the tissue into the bed. The bed's got a reasonable bit of give in it, so has the gas drop, but what we don't want to be doing is, as we're applying a force, we're actually getting this tissue compression against the bed. So it's just a case of trying to give it a little bit more freedom of movement in midair. As you see, as I apply the sort of grade 3 and grade 4, we will get a little bit of tissue compression. We just need to take that into account with our forces. So for setup, so leg in a nice neutral position, we're going to feel for the joint lines. We've got mesilateral epicondyles, we've got tib tuberosity, tibial plateau, so that is where I want to apply my force. I'm using the web of the hand. We use web of two hands, okay, across this point, so here and here, and then shoulders and elbows right above the point just there on the tibial tuberosity. We're going to apply our test range. Remember, we would be checking for resistance and also where pain was in relation to resistance. We apply our force. And then we come back, and so I'll show you a grade 1. Show you a grade 2, a bit more emphasis of coming off. Grade 3, we go through into resistance in large amplitude. And then grade 4, more towards the end of range, small amplitude. So that's our AP of the tibio-femoral joint. As an alternative method for an AP for the tibio-femoral, we can also do it in ranges of flexion. So the first technique was really a pure in extension position, but actually let's think about it. An AP is to improve flexion. There's not going to be too many times where you need to do it in an extended position. Therefore, we can do different levels of flexion. I'm going to show it at around about 90 degrees, but you could adjust it to any level of flexion that you need, just with some more support, some towels, pillows, cushions, etc., to get it into that right position. So if we take it up to around about 90 degrees, say here, we need to ensure that we're stabilising the femur so that they relax. Remember, we want relaxation so that we can get our passive movement. And then we're going to apply the pressure exactly the same as we did before, but rather than using the web, you're going to go in here between the thenar and hypothenar eminence. Okay, so the tibial tuberosity goes in there, then the pressure is going to come through my forearm, coming from my pecs. So therefore, you need to go at 90 degrees to this tibia here, so I'm going that way. Okay, so then I can stabilise in here, nice firm grip on that femur, positioned in there, and then I'm going to apply my pressure. There's my test range, checking for pain, and then I can do my grade 1, grade 2, emphasising coming off, grade 3, now through into resistance, and grade 4. As you saw there just while I was demonstrating, we had a little bit of movement of this leg. One of the things we can do there is we can just remove a little bit of the bed so that they actually go in contact with the vinyl. That will cause a very, very small amount of sweat to form on their foot. I know that sounds a little bit horrible. What that'll actually do is give us quite a good stick. Look, here we go, look. So all of a sudden they start to stick to the vinyl and it stops some of that movement. So if you get that problem, no problem, just take off a little bit of there, and then we can get back onto here and apply our force. So that I can now be quite mobile and the foot's not going anywhere. Okay? So working on a PA now, the tibio-femoral joint. So we've got the knee slightly flexed, supported under here, so we've then got a gap for the tibia, so the tibia actually has somewhere to translate into. Because of that, we need to follow the line of the tibia, so we're actually going to be going at an angle roughly like that. So we're perpendicular to the tibia, so it's slightly downwards towards the feet. So a couple of methods of doing this. First of all, we can do the double web grip, which is just coming round here, so we're posterior and we're distal just on the tib and fib. You've obviously got to bring your body therefore forwards so that you can apply the force down and slightly backwards. So we can apply our pressure here, testing the range, finding out for pain, grade 1, grade 2, coming from the elbows as we push down, try not to bob yourself up and down, grade 3, into resistance now, larger amplitude, and grade 4 towards the end of range. Now, as some of you know, I've got quite bony thumbs and fingers, and it can be quite uncomfortable, especially on this lateral edge here, around the back of the head of the fibula, perineal nerve, those sorts of things. So what we can do is we can also use this part of our hand, the palm of our hand, just to spread the load slightly coming across this way. So now I'm going to use, again, my forearm direction is the direction of force. Just going to support the lower leg with my other hand. Then I'm going to use my force coming down here, coming again from my chest. This way. There's a slight change in your handling. Remember, it's the same effect, so we're doing the same treatment, just a slightly different way of handling. Passive accessories now for rotation. So in this position here, what we've got, so this is the accessory, remember, when it's bent, then that's when you have your passive physiological, because they can also replicate that. In an extended position, the patient can't rotate their tibia. So what we can do here is we can work on our rotation element with them in an extended position. I'm just off extension here. You can adjust this to suit the patient and suit the demands of what they need. So ultimately it can be anywhere from this slightly flexed position all the way into extension or even hyperextension, where you can put the towel or the pillow underneath the heel if you're trying to force them into extension. Normally you wouldn't do that if a patient was just laying down, but if you clinically are trying to achieve it, then it can be done. So in this position, what we're going to do is I'm working across onto this side because I want to be able to push here. So this is not just for the camera, I am working across on the opposite side to the side that I'm actually working from. Hand comes right underneath, so I can see the fingers on the inside of the leg. So my hand is underneath the thigh at the distal end of the femur. I then use my forearm to clamp down and stop that there would be any rotation of the femur turning laterally. Now what I'm going to do with my other hand is come on to, so we've got the anterior border of the tibia here. We're just going to come round medially and posteriorly and sit behind the tibia there, so that we can effectively rotate the tibia around this way. So we come up and behind, and then we're going to apply our techniques. So my handling is this way, thumb sitting there beneath and below. Okay, so we apply our rotation, a nice amount of torque on there, checking for obviously the amount of movement, resistance and pain. And then we can do our grade 1, grade 2, slightly larger, grade 3, get into resistance now, grade 4, small amplitude, end of range. As an alternative, you could also work from the lower legs, you could work from the foot, affecting the same thing. So again, just trying to stabilise here. So if you find it particularly difficult, or if they have really quite a large calf muscle you can't get in behind, then you can also come from here. Just raise this bed up a little bit. So you can then work from the calcaneum and then take it into rotation this way. Okay, and obviously you can do your grades 1, 2, 3 and 4. So that's for lateral rotation, for medial rotation. So we'll do the same thing, I'll just pop this under here. You don't have to do it this way, it depends upon the position, remember. Same thing, hand underneath, holding onto the femur, clamping the forearm down. Now I'm on the anterior, slightly lateral border of the tibia. I'm going to clamp that down there, and then I'll apply my pressure exactly the same into rotation. Testing, grade 1, grade 2, emphasize coming off, grade 3 into resistance now, and grade 4 towards the end of range. Okay, superior tib fib joint now, so we're going to do an AP. So when we're doing our AP, we need to bear in mind the positioning of the fibula. The fibula is slightly posterior to the tibia, so it's almost slightly behind. Therefore, when we do an AP, ideally we don't want to go purely straight backwards. We need to follow the orientation of the joint and come actually slightly medially when we're applying our AP glide. Okay, so slightly medial with our orientation. So we're going to do it in a flex position here, slightly more comfortable and easier to administer. We're going to use our thumbs for grade 1 and 2, so we're going to go inwards slightly. Onto the front of the head of the fibula, make sure you've got a decent support of their thigh and upper leg, and if you find this really difficult, you can still do it in this position. But I'm going to do it in a flex position. So up in here, onto the front, head of the fib, and we're going to apply our pressure forward, just testing the range. Get a slight movement of the foot there. If needs be, we can always remove this, remember, so that their foot sticks to the bed a little better. So we do our grade 1, grade 2, emphasise coming off. Grade 3 and 4, I'm going to use my pisiform grip. Again, nice and stable with the rest of the femur. Okay, so we're here, just going on to the front there. I'm going at a slight angle. Grade 3, and then small amplitude, grade 4. PA now for the superior tibiofibular joint. So we're going to apply a technique now where we're going to again try to follow the orientation of the joint. We said before when we were applying the AP, we were coming slightly medial. So now when we're doing the PA, we're also going to go slightly lateral. We're going to try to use a softer part of our hand now, okay, so thumb side essentially, so that when we're applying the technique, because essentially we have the common perineal nerve wrapping around the head of the fibula here, we want to try to avoid any sort of pinching and pain that may cause. So as we apply it, we want to use a softer part of our hand. Okay, so we're going to come onto here. Applying the grade slightly orientated laterally and postero-anteriorly. Applying my test range. Okay, feel resistance, come back. Grade 1. Grade 2, emphasise on coming off. Grade 3, into resistance now. Grade 4 towards the end of range. So it's working here. We could also use pisiform grip, can be a little bit bony though. We could also use thumb grip, double thumb grip, and again it can be a little bit painful for the patient. So try to work within the realms of what the patient finds acceptable pain-wise.